Hello all of you, welcome back to our channel which is Study Smart with me, and today we are again back with our video related to the PYQ sessions only, and the question from 31 begin from today. So let's see first question. In the lateral view radiograph of the head, which lettered structure located between the orbit and nasal cavity contains numerous small cavities? So this is the diagram, you can see appropriately. And what we want orbit and nasal cavity. Yeah, answer is, tell me answer. Correct, answer is D. So let's see the explanation behind it. The ethmoid sinus has numerous small cavities and lies between the orbit and nasal cavity. So this is the diagram, you can go through with it also. This is sphenoidal sinus. This is ethmoid bone. This is superior nasal concha. This is medial nasal concha. This is inferior nasal concha. Okay, let's go to another question. A 66-year-old woman presents to the emergency room with dizziness, nystagmus, and various neurological deficits, including loss of pain and temperature sensation on the right side of her face and left side of her body. Ataxia, intention tremor, hoarseness and pupillary constriction with drooping of the eyelid of the right. She has also dryness on the right side of her face. Now you have to tell which artery blockage is most likely responsible for her condition. So it would be right posterior inferior cerebellar, or left posterior inferior cerebellar, or right anterior inferior cerebellar, or basilar artery. Let me know the answer, guys. Guess it. Correct. Answer is A. So let's go with the explanation. This is a case of right-sided Wallenberg syndrome due to occlusion in the right posterior inferior cerebellar artery leading to lateral medullary ischemia and lesion of certain nuclei and tracts. The posterior inferior cerebral artery, means PYQ, carries blood to this part of the brain. This stroke, Wallenberg syndrome, causes the person to have balance problems and lean on one side. They may also have numbness on one side of the face and body and eye droop. They may have hoarseness and trouble swallowing. So these all the conditions happen when the person is suffering from the Wallenberg syndrome, and the syndrome is due to the PYQ. And what is PYQ? Right-sided one. Next question. Which pathways is involved in the ability to identify a familiar object placed in the hand without seeing it? What is the answer? Tell me. Yeah, D. Dorsal column. Dorsal column. Ability to recognize an unseen familiar object is known as stereogenesis. A person who can recognize unseen familiar object is known as stereogenesis, and that is carried by dorsal column. That is carried by what? Dorsal column. This is the diagram, you can go through with that. Okay, let's come to the another question. The innervation of middle ear is derived from. Tell me the answer, guys. Tell me the answer. A, B, C, D. What would be the answer? Superior auricular, greater auricular, tympanic branch of glossopharyngeal nerve, pharyngeal branch of glossopharyngeal nerve. I hope you got the answer right. Yes, tympanic branch of glossopharyngeal nerve. Sensory nerve supply of middle ear cavity is provided by the glossopharyngeal nerve. Okay, now we have to tell about the middle ear. The middle and external ear are also supplied by the branches of the trigeminal, facial and glossopharyngeal and vagus nerves, which results in referred pain in the ear from other areas supplied by this nerve: the teeth, posterior part of the tongue, pharynx and larynx. So this is the diagram I have given to you. You can go through with this. Okay, got my point? Let's come to the last question, image based question it is. Which statement regarding the highlighted structure of the scapula is accurate? So you have to tell the correct answer. Marked arrow shows is acromion, traction epiphysis, long head of biceps brachii muscle or atavistic epiphysis. What is the answer? Tell me. Guess it so early, okay? Yeah, D. It is an example of atavistic epiphysis. Explanation about it: mark structure shows the coracoid process. What is this? Coracoid process, which is an example of atavistic epiphysis and its site of attachment for long head of biceps brachii muscles. So this is the clavicle, this is the coracoid process, this is the acromion process, this is acromial angle. You can see this is the angle, kind of this. This is spine process, this is scapula. So here we have done with our another video. Thanks for watching me. And today I have hidden the answer because there was one suggestion and I really like it. One of the we can say our doctor suggested me that you please ma'am, please hide the answer so we can also guess together, and I really like the suggestion. So if anyone else also have any suggestion, just do let me know and we will definitely work on that. I hope you are liking my video, so please subscribe my channel. Thanks for subscribing if you have already done it, and be connected with me. Don't shy to give me any suggestion. You are free to tell me anything through your comment section, and stay connected, stay healthy and do hard work. Thanks for watching me. Bye bye.